Listen to me very carefully. If you're over 60 and a doctor asks you any of these 6 questions, you need to walk out because they either don't know what they're doing or worse, they're lying to your face. This message may just protect your health, your independence, and your dignity. So please stay with me until the end. And if you've ever been asked something questionable by a doctor, share it in the comments below. I read every single one. And don't forget to like and subscribe if you care about real health advice for older women. Let's begin. 1. Are you sure it's not just your age? This is one of the most infuriating and dismissive questions any older woman can hear in a medical setting. Unfortunately, it happens every single day. You walk into the office because something doesn't feel right. Maybe your joints are stiff in a way that doesn't feel normal. Maybe your heart is racing more often. Or maybe your memory isn't as sharp as it used to be. You explain this carefully, clearly, hoping for answers. And the doctor leans back and says, "Are you sure it's not just your age?" Let me tell you, I've seen that sentence destroy trust in an instant. Because what it really says is, "I'm not going to investigate. I don't believe your concern deserves effort. I've already made up my mind based on your age alone." That is not medicine. That is ageism in a lab coat. I once had a patient named Margaret in her late 60s who complained of chest discomfort and nausea. Her doctor brushed it off as indigestion and said it was probably just her age. 2 days later, Margaret had a minor heart attack. That dismissal nearly cost her life. The phrase, "just your age," has been used to ignore treatable thyroid problems, early dementia, autoimmune diseases, and even cancers. When doctors lump every symptom into just aging, they erase your individuality, your medical history, your genetics, your habits, all of it. Yes, aging brings changes, but pain is still pain. Fatigue is still fatigue. And a new symptom is always worth attention. You deserve a doctor who investigates, not excuses. So if you hear this question with no further tests, no thoughtful conversation, you owe it to yourself to walk out and find someone who sees you as a person, not a stereotype. 2. Do you really want to do all these tests at your age? This one might sound like concern on the surface, but underneath it's often a troubling suggestion that you are not worth the time, money, or effort. Let's say you're dealing with confusion, shortness of breath, or abdominal discomfort that keeps waking you up at night. You finally book the appointment, sit down with your doctor, and they start listing necessary scans and lab work. Then suddenly the tone changes. They pause and say, "Do you really want to do all these tests at your age? Do you see the problem here?" It implies that seeking answers is somehow selfish or unnecessary, that your age means you should just accept discomfort, confusion, or decline without question. That's not only insulting, it's reckless. One of my patients, Helen, age 76, complained about sudden mood swings and foggy thinking. Her doctor said it was normal aging. When she pushed back and requested imaging, he replied, "Do you really want to do all that?" She came to me. We ran the tests. It turned out she had a vitamin B12 deficiency and a urinary tract infection, both treatable, both mimicking dementia. She didn't need to suffer. She just needed someone to take her seriously. If a doctor suggests skipping tests, they better have a clear, evidence-based reason, not just a dismissive opinion about your age. Your body deserves care. Your symptoms deserve investigation, and you deserve the same standard of care you would have received at 40 or 50. If they suggest otherwise, don't hesitate. Get up and go. 3. Are you still sexually active? Let's talk about one of the most awkward, misused, and often inappropriate questions doctors ask senior women. Yes, in some cases it has genuine medical relevance. If you're experiencing urinary symptoms, pelvic discomfort, vaginal dryness, or hormone concerns, it's worth discussing, but only if the question is asked with care, clinical intent, and respect. Unfortunately, that's not how many senior women experience it. Too often, it's thrown in casually with no context, no warning, and worst of all, a tone that implies judgment, surprise, or even amusement. I've heard from older women who went in for back pain or blood pressure checks, and completely out of the blue, the doctor asked, "Are you still sexually active?" Still, as if intimacy disappears after menopause, as if a woman enjoying closeness in her 60s, 70s, or beyond is shocking. That kind of question, asked the wrong way, feels invasive. The result? Women shut down. They avoid discussing real concerns about intimacy, hormones, or discomfort because they've been made to feel embarrassed or ridiculous, like their body no longer matters. One of my patients, Eleanor, age 82, confident and proud, told me, "The way he asked, I felt like a naughty teenager being caught. I just lied and said no." She wasn't ashamed of her relationship. She was ashamed of how she was made to feel. You are never too old to deserve respectful medical care. If the question is relevant, it should be explained. If it's not, it should never be asked at all. And if the tone is off or feels condescending, you don't owe that doctor another minute of your time. 4. Are you still living alone? This may sound innocent, but the way it's often asked can be unsettling, especially when they put emphasis on the word still. Why is that word a problem? Because it implies that living alone as a senior woman is unusual, risky, or even irresponsible. Many of my patients over 65 are incredibly independent. They cook, drive, volunteer, lead community groups, hike, and yes, live alone. Not because they have to, but because they want to. But when doctors ask in a way laced with suspicion or pity, it feels like your independence is on trial. One of my patients, Dorothy, age 79, sharp as ever, managed her own finances, medications, and home for decades. She came in for a mild foot injury, but the doctor spent more time questioning how she bought her groceries than examining her ankle. She told me, "I walked out feeling like I had to prove I wasn't helpless." That's not medicine. That's condescension disguised as concern. If a doctor asks because of genuine concern, such as cognitive changes or frequent falls, that's different. But it must come from respect, not assumption. If you're living alone and thriving, you should be celebrated, not questioned. And if your doctor implies you need supervision before assessing your real situation, it may be time to find someone who treats you as capable first, not fragile. Living alone doesn't mean living at risk. It means living on your own terms. 5. Do you want to talk to your daughter about this first? This one can really sting because it strikes at your ability to make decisions. You're discussing treatment options or a new medication, listening carefully, asking smart questions, weighing pros and cons. And suddenly the doctor says, "Do you want to talk to your daughter about this first?" Would they ask a 45-year-old man if he wanted to consult his adult child about a prescription? Of course not. But for some reason, when you're an older woman, your judgment is suddenly in question. One of my patients, Patricia, age 68 and recently widowed, went to discuss a possible knee replacement. The surgeon explained the procedure, and before she could respond, he asked, "Would you like to bring your son in to help you decide?" She was stunned. "I wasn't asking for help," she said. "I was asking for options." Questions like this plant doubt. They feed the stereotype that older women are fragile or incapable. Unless you've legally appointed someone to make decisions for you, your doctor should be speaking to you, not around you. You have the right to make your own choices, ask your own questions, and take control of your care. If a doctor doesn't respect that, they don't deserve your trust. 6. Are you sure you want to keep taking that medication? On the surface, this sounds helpful. A good doctor should review your medications regularly, especially as we age. But too many ask this without offering a plan, explanation, or understanding of what the medication is doing for you. It becomes less of a discussion and more of a warning, almost like they're trying to scare you off without a clear reason. For example, I had a patient named Joanne who had been on a mild antidepressant for years. It helped her stay balanced and active after losing her husband. A new doctor told her, "We don't usually like older patients staying on these long term. Are you sure you want to keep taking it?" No review of her mental health, no alternatives, just subtle pressure to stop. She tried going off. Within a month, she was isolated, anxious, and calling her kids in tears. That's not how medication management should work. If you've been on something for years and it's working, there needs to be a very good reason to change it. If a doctor wants to stop it, they should explain why, discuss side effects, offer a safe plan, and most importantly, listen to you. Because you've lived with this body longer than they've studied medicine. If they can't offer a better solution and are just pushing you to drop something that's helping you, that's not care. That's arrogance. And you can and should walk away.